We're here in Washington County, Maine. It's the easternmost county in the state and one of the most rural counties in the area. It also has the unfortunate distinction of being one of the poorest counties in the northeastern United States.
The need is extensive. The need is as extensive as it probably is in other areas of the world. We know that people work multiple jobs to try to make ends meet, and it's expensive. It's expensive to heat our homes and to feed our children.
Getting to the dental office is a challenge for a lot of different people. Many children are waiting long periods of time in pain with toothaches and abscessed teeth and just aren't able to find the dental care that they need.
We have a severe shortage of dentists. There's only about 6 or 7 practicing dentists at this time in this area of the state. There's also a shortage in terms of the number of those professionals who take the state Medicaid program. So you have a case where you have an aging population of dentists, you have a shortage that exists already, and it's not too hard to project that we're really moving into a crisis type situation.
Nationally, there is a huge problem with access to oral health care services. This is true in every state, in every part of the nation. The number of dental graduates over the past 2 decades has been almost constant, but the population has increased by almost 60 million people.
This particular program is so exciting because this was a grant from Delta Dental on access to care. Who can help Maine on access to care? It was a natural for us.
The Northeast Delta Dental Foundation's mission is to improve oral health access in the communities we serve. NYU was very interested in us. They wanted to learn about us and our challenges. It was a perfect fit because it was hands-on care in a community that needed it very much.
The waiting lists in Washington County to get your children into the dentist are, a year to 2 years, unless it's an emergency. Most of the dentists around here do not take Maine Care, and all of my children are on Maine Care.
I've had really bad experiences, and I haven't had the money.
It's a choice that no parent wants to make, but it's a choice many parents have to make. Do I put food on the table, oil in the tank, or get my child to the dentist or the doctor?
There are people who need dental care and who cannot afford it. And there has been a maldistribution of dentists. Dentists gravitating towards suburbs, dentists gravitating away from rural communities and the center of cities.
Many times we know there's a child that has been in pain, that has several teeth in decay. It's very difficult for them to concentrate in school, for them to focus on anything but the pain.
We have children who may have had abscessed teeth, needing care for a good long time. They're not eating well, they can't eat well, they literally cannot chew the food. They're not getting the nutrition that they need, and it's just impacting their entire growth and development.
People are usually lined up before we get here.
I know that people aren't getting the care that they need, but to see every chair in the waiting area full, it's just extraordinary.
We will see over 350 visits for the children, and we will have completed over 95% of all of the care for these children.
I really love the fact that they're here to help me do what, my job as a mom. And a part of that is to keep my kids safe and healthy.
We've had him to 2 or 3 dentists, and he wouldn't let anyone touch his teeth at all. And Scott, the dentist, he worked really well with him, got him comfortable, and just extracted three teeth.
The professionalism, the excellent level of care, the compassion that they're receiving from the team is incredible.
What is all this stuff?
The community loves the NYU team. We love New York. Maine loves New York.
The feeling you get after helping everybody, the satisfaction, the gratitude that you see from parents coming back, from the children giving us hugs, that gratitude is really why we're here.
This is the best part of my education. When you live in New York, it's really difficult to comprehend that really a few hours away from here, there is a great need for healthcare. And the outreach program here at NYU College of Dentistry really allows you to understand what's the public health need of dentistry.
I was really impressed with the way NYU collaborated with the community leaders, the oral health professionals, the people who know about the problems of access to dental care.
We have had great partners in this area who have really been trying to get access to care for the population around here as much as possible. Delta Dental, which helped fund this. We're supported by Shine, which has been a partner with us for over a year in all of our outreach activities.
The NYU team has been, I don't know how they do it. I'm looking at them today thinking, how are these people still walking? They've been very, very respectful of our families. They've been amazing with the children. And the other piece of this for us is not only our children being seen, but their parents are being seen.
We have seen in adult emergencies 80, 90 patients a day. The idea when we came here was to try to make this a model in sustainability. It's really done with the children. The idea is give them comprehensive care and get them on a preventive program. We can go from a 30 or 40% decay rate down to a 15% and maintain it.
It's been amazing and overwhelming. I have found myself with goosebumps many times throughout the week. A couple of times had tears in my eyes just watching the children get their care that they need, but just as importantly, watching the parents and the relief that the parents have. They don't want their children to be in pain, and some of them have been in pain for a good long time.
It's teaching kids to not be afraid, and they're getting their teeth seen and they're able to sit in school without their teeth hurting. It's amazing. Keep doing it, don't stop.
I have been working in this field for 15 years, and this definitely was one of the best experiences I've ever had.
To see people are just so appreciative. They leave with a smile on their face and they thank us, for sure. I've had more hugs this week than I have in the last year. It's just amazing.
Most importantly, I know when I'm walking into classrooms next week and I'm seeing children smile, that they could never put into words what it means for our kids and families. And that's just going to lead to a stronger family because their dental needs are being met.